Most experts seem to agree that we should have a vaccine for COVID-19 by the end of the year. But once it becomes available, the question is, who should get it first? Policymakers will soon be faced with difficult questions around which groups should be prioritized. So joining me now with more is CTV's science and technology specialist, Dan Riskin. Dan, great to see you on the show today. There is general consensus that frontline workers and healthcare workers should be among the first to get this vaccine. We got to protect those who've protected us. But then what questions go into deciding who gets it next?
Yeah, it's a tough question because clearly there's going to be, this vaccine is going to be a lot of demand. And so not everyone's going to be able to get it at once. And so do you try to minimize deaths? If that's what you're doing, then maybe you make the elderly, you put them to the front of the line, people with pre-existing conditions. But maybe instead what you want to do is make the disease go away. So then perhaps the best people to get the vaccine are the people who spread it more. And if that's the case, then maybe young people should be getting the shot. Or maybe you want to have the least number of hospital stays. And so depending on what you optimize, you come up with different answers to the very difficult question of who gets the vaccine first. I mean, clearly the answer is give it to everyone who wants it. But because you can't do that, you really do have to make these decisions. And so what policymakers are doing now is having these conversations so that when the vaccine shows up, we're not scrambling to have a big fight about it.
There are also some really contentious and hot button questions that need to be addressed. Should race, socioeconomic questions be brought into the mix? What factors should those play in getting a vaccine? Or what about people in prisons? We know that those can be hotbeds for the spread of COVID-19. So what is going to be driving those questions and answers?
Yeah, I mean, these are going to get to some, you can imagine a lot of people are going to get very worked up. So if you think about the issue of race, Black people in the United States make up a quarter of all the COVID cases. They make up roughly an eighth of the population. So they're getting COVID 2 to 3 times worse than people who are white and other minorities. And so one possibility is you say, all right, let's move people who are Black to the front of the line. And you can imagine what kind of a kickback there might be if people said we're going to make this a race-based situation. But of course, the disease is playing the race card. And so why shouldn't the fight against the disease also do the same? You can also look at the Navajo Nation, which has the worst numbers in all of the United States. Perhaps race there needs to come into play. So normally race is something that people, I mean, in Canada, the race data are just really hard to come by. Canada's not releasing the data on how this is affecting different groups. And so clearly this is something some people don't even want to talk about, but race is a big part of what's happening in this epidemic. And if we're going to talk about who needs to get the vaccine first, maybe race comes into it.
What about countries? My guess is certain countries are going to get access to it first, even though they may not need it first. So what's going to be driving that conversation?
Right. The default is going to be whoever invented it or whoever came up with the vaccine is probably going to get first crack at it. But you can imagine that the rich countries are probably going to have an easier time getting a hold of it than the poorer countries. But maybe it's as simple as who's got the worst outbreak. Now, you can argue Canada has been well behaved. We have flattened the curve and people have been socially isolating. Perhaps we deserve to get the vaccine because we've done our job. Or do you look at a country like the United States where it's completely out of control and people are not everyone is behaving the way they're supposed to? Do you reward that behavior by giving them first access to the vaccine? Or do you, play the grown-up here and say, look, they're having a pandemic. We have to give them access to this vaccine because we're going to save more lives that way. So this is a conversation, I can imagine how difficult it would be for Canadians to take that pill to say, you know what, there's a vaccine, but we're not going to take it because we're going to give it to our neighbors down south because they don't seem to be able to control this pandemic through other means.
Well, I think that regardless of whatever decision Canada takes, that we have that conversation in the open as opposed to in secret and then just announcing it. I think the more people that participate in that conversation, the better off we'll all be. Dan, thank you so much for being here. We appreciate your time.
Thanks, Ben. Take care.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.